help support our coverage using Blueberry, the community that gives creators the ability to make money, get detailed audience measurements, and host their audio and video. Get 30 days to try out the service using promo code Blueberry004. That's BLUBRRY004.
Next up is Daga. Is that correct? Daga?
It's DOA. The G
Doa.
is silent.
Okay,
Yeah.
Doa. Oh, you're going to have to tell. I'm going to destroy it. Go ahead and introduce yourself.
Hi, everybody. I'm Doa. I'm from Turkey. I'm one of the co-founders of MediTechLabs. We're a health tech startup that focuses on reducing the documentation and paperwork burden for healthcare professionals.
You know, I'm not in the healthcare field, but you just see when you go to the doctor, they're just typing.
Exactly.
You know, they do your consultation and they turn to their computer and then they just type for 10 minutes.
Yeah. As a patient, I wouldn't say user experience, customer experience, but it is in a way like that. When you're sick, when you have a problem, you do want the doctor or the caregiver to really focus on you, look you in the eyes, and understand with empathy what's wrong with you, what you want out of the consultation.
Mm-hmm. So in your company's regard, what are you doing to help that interaction then? Tell me what you're doing.
Okay. What we do is we have an AI application that listens to doctor-patient dialogues. We don't keep voice recording, we just convert it to text. And in that text, we analyze it and we gather clinically important information like patient's complaints, family history, medications that they use, and etc. And then we create this into a report format for the doctor. And this data is sent directly to the doctor's hospital health record system. So by the end of the consultation, he or she has the full report readily available in his computer.
You know what's interesting is I go to the doctor's office if I have a new doctor, or if you're in a primary care where you don't actually have a primary care provider, you see a different doctor every time.
Yeah.
You know, the same thing. It's like I already put all my family history already in the system.
Yeah.
But again, they have to go read it. So the doctors don't do it and say, okay, you know, what do you guys have? Heart disease, you have diabetes, you know, they run through the list of, you know, what the family history is, and you've already provided it. Do you guys do a cross-check then on basically the stuff that patients have submitted themselves?
Yeah, we do. Actually, we want to create a space where when you tell a doctor what's wrong with you, everybody in that hospital could also know that, access that, under your consent, of course. So we don't want you to lose time. We don't want the doctor to lose time, because we're in 2024, you know. We talk about amazing technologies here, but health tech or health services isn't there yet. That's, I think, something to think about.
So with AI, you know, it's not perfect yet. It still runs home to mama once in a while and does something weird. So when you get done with the AI collects the conversation, the doctor then I'm sure has to review and approve. Everything that the AI collected.
Yeah, the doctor has to do that, and it's completely editable. So if he wants to omit something, he or she can add something. That's also possible. We just want to save time, because in the US, approximately 60% of the time in consultations, the doctor is looking at the computer screen. That's a lot.
It's a lot. So what has been the response? Have you done customer testing with this yet?
Just as we get back, in the third week of January, we're starting a pilot program in Europe's biggest, most digitalized hospital. So that's going to be both a challenge and amazing opportunity. And in March, we're doing an English pilot. The first one was in Turkish. The second one will be in English, and it will be in Saudi Arabia, their biggest hospital group.
Sounds to me like what you have done then is probably modeled the AI based upon. Do you set it up for each hospital, because each hospital has their own forms and so do you kind of match that on a customer basis?
Great question. What we match actually isn't the hospital. Of course, if the doctor has specific requirements, we do match that, but we match the EHR, the electronic health record system. So we integrate with them, so the doctor doesn't even have to use another application. He just has it on the screen.
It's on the screen automatically. All right. So if a company that is a healthcare provider here in the United States or a group is looking to check out your technology, where can they find you?
They should go to www.meditechlabs.ai. They can book a demo there, and we would love to help anyone out. We can help you with the documentation, the paperwork burden, and reduce your administrative costs. That's also important for hospitals.
Yeah, and get everything documented, because oftentimes I've came back and they said, well, we talked about it in the last consultation. You didn't put it in the computer.
Yeah.
Because, they're busy. They're busy, so they're typing away quick, and how can they recall everything that happened during the conversation completely?
Yeah.
Yeah, so I think this is good.
Thank you so much.
So outstanding. All right, Meta, M-E-D-I, techlabs.ai. And Noah, thank you so much for coming on.
Thank you so much for having me.
Yeah, absolutely. Appreciate it. And good luck with your trials.
Thank you so much.
Yeah, absolutely.
Have a good one.
Yep, thank you.
The Tech Podcast Network CES 2024 coverage is executive produced by Michelle Mendez. Technical directors are Kurt Corliss and Adam Barker. Associate producers are Nancy Ertz, Clinton Millsap, Sergio Velasquez, and Terry Willingham. Voiceover by Aaron Hurst. Our hosts are Marlo Anderson, Don Bain, Todd Cochran, Scott Ertz, and Christopher Jordan. Studio and equipment are provided by PLUGHITZ Productions. This has been a Tech Podcast Network broadcast, copyright 2024.